Let's get some sense on this new variant, the Omicron variant. One of the doctors who discovered it is Dr. Angelique Coetzee. She's chair of the South African Medical Association and a GP in Pretoria. I'm delighted to say she joins us right now. Good morning to you, Angelique.
Good morning, Julia, to all your viewers out there.
Lovely to talk to you. Now, you are one of the people who identified this variant. And you're also one of those who's been criticising the complete overreaction, as you see it, in the UK and Europe and elsewhere around the world, shutting borders to South Africa and other African nations and moving to panic stations. Why do you think people are overreacting?
So, Julia, a very good question. We only became aware of the clinical picture of the virus around about the 18th of November. And no, we didn't miss it before. If you look at our infectivity rate on that Monday and Tuesday, it was still, even on the 18th, it was still less than 1%. Today yesterday we stood on a 9.7%, if I'm not mistaken, infectivity rate. It did start in Tshwane or Pretoria, that is the epicenter, and this is actually where I'm also working full time. And because I'm part of that Ministerial Advisory Committee on vaccines, I am in the background very much involved in this. And so when I saw the first patient, and also very important to understand that about between 8 to 10 weeks, we virtually didn't see any COVID-19 new cases. When this patient came in, he incidentally also made an appointment for the rest of his family, young man around about 30 years of age, and sitting in front of me and saying for me, "Doctor, for 2 days I'm extremely fatigued. I've got body aches and pains and a bit of a slight headache," which is very suggestive of a viral infection. I decided to test him, and it became positive. And I then tested the family, and they're also positive. The one is a baby of 4 months. And but the baby didn't have any symptoms. They brought the baby then into me to double check. So I then saw 7 more patients that day, and because the symptoms were more or less all the same, it's the fatigueness that actually is the major driver of bringing them to the surgeries. I then alerted the VMAC. Again, I've got access to that. I'm part of them, and say, "Listen, guys, here's something wrong. I have seen patients today tested positive. It's not the Delta variant." And why can I say it's not the Delta variant? In the third wave, I myself personally treated more or less 600 patients physically in my surgery, not on any media platform. So I've got quite a lot of experience around this. And these symptoms not the same. It's very mild. And up until today, the patients that we've seen are mild patients, mild symptoms. And the ones that I have seen from the 18th up until now, all of them recovered. None has been admitted. No oxygen necessary so far. And also no indication of any oxygen.
Okay, so you know what you're talking about. You've been at the sharp end, and South Africa had some, very nasty Delta wave, no doubt at all. You believe it to be a new variant. The World Health Organization saying, it is a variant of concern. It does appear to be more transmissible, but as you're saying, it doesn't appear to give more severe disease. In which case, if it is mild, is it a particular concern if it's more transmissible is the next question. But there also seems to be a concern that it can escape vaccines. The vaccine manufacturers have all said they don't believe that it would. Why are people concerned that this could escape vaccines?
I think the reason is the mutations, because there's more than 30 mutations. And I think that is the problem that scares the world. And our scientists were very clear when they said they don't know what it means. They're still in the background busy, and they said that they would only be able within the next 2 weeks, that's from last week, to be able to give a better picture. And you have to understand, we're not saying that you're not going to get severely ill. We're not saying that we won't see a larger number going forward. As early in the pandemic, we know that it's normally the young people who would be affected, who would have less symptoms. But as it stands today, our ICUs are not overwhelmed. There's not a lot of COVID-19 patients in our ICUs in the Pretoria region. Our hospitals, public sector hospitals, they have a higher influx of children with COVID-19 than adults. And again, the question is what symptoms they do have. Yeah. So we can, as general practitioners, we cannot speculate on that. What we can say is what we see under the general population coming to visit our surgeries. I confirmed this with my other colleagues also in the area. And we're all of the same opinion, mild disease so far. We're not saying it's not going to change going forward. But for now, the hype doesn't make any sense to us at all.
And in terms of the shutting down of flights and contact with 10 African nations now, including South Africa, there is a concern that the nations which do this work, who highlight any variants of concern, who do the genomic sequencing, and South Africa has very, very good scientific labs on this because of dealing with HIV and dealing obviously with COVID as well over the last 20 months. That in a way we're penalising the countries that are honest and open and do the genomic sequencing, and they're punished for coming up with information and sharing it.
Exactly, Julia. So, knowing people and knowing behaviour and knowing governments by this time, I can promise you other governments and other states would be less inclined to speak out going forward, because if this is the backlash that you get, less than 24 hours after you have announced, listen, this is what we're seeing. We're not even saying that it was first detected in South Africa. We're just telling you the facts. Yeah. And then we got slammed. I'm quite sure you are seeing much more people in the UK and in the Netherlands than we are seeing. And because of the mildness of the symptoms, they might be missed.
Yeah. Just finally, in terms of when people say, "Oh, better be safe than sorry," though, we'll put everyone back in masks, we'll limit travel, we'll do all of that, but just in case, do you think that is the right move for a government to make?
No, not at this stage of the game. It's still too early. So what I would have done if I'm the government, I would have made again compulsory the wearing of masks, 1.5 meters. The ventilation, the non-pharmaceutical interventions. That's what I would have made. I would have made sure, because I'm a rich country, I would have made sure that my people are above the age of 50 get their third booster vaccine with Pfizer. And if they had Johnson & Johnson, get them their second Johnson & Johnson vaccine. And that's what I would have done, and alert them that there might be a problem going forward. Stay away from crowds. Okay. That sounds much better.
Really good to talk to you, Dr. Angelique Coetzee. Glad we did manage to get you on the line. Chair of the South African Medical Association. Appreciate that. 7:42 is the time.